Can transplanted grafts really fall out again? I still remember it well. My transplant was about 2 years ago, and after the procedure, everything revolved around the question of when my grafts would be firmly established. Can they theoretically fail again in the first few days? What do I need to consider to ensure the optimal strength of the graft? And that's exactly what the video is all about. I'll answer your questions about when you can be sure that the grafts have been optimally accepted and how you can proactively influence the whole process. Stay tuned. Emphasize, from a professional perspective, the transplanted hair comes from the donor area during the exciting process of hair transplantation. It's located, if you might already know, at the back of the head. The crucial thing now is that the individual grafts are taken from the back of the head. Once the grafts are extracted, the natural flow of nutrients and blood is severed as the supply is cut off. Then it's especially crucial to put the grafts, like Elite does, into a nutrient solution so that they can be optimally preserved in that case. If this whole thing isn't done, the grafts can be damaged in the long run.
Generally, you can expect a growth rate of around 80%.
At Elithair, it's crucial that the fibers are removed prior to the hair, so the hair is further strengthened through the special NEO FUE method. What's hiding? Are you wondering about the NEO FUE method by Elithair that includes this set? The whole thing, as I just mentioned, is applied once during the preparation in order to optimally strengthen the hair foil, before the transplantation. Part of the set, especially here, is the derma roller. Maybe you've seen him before too. The derma roller is used both in the donor area and in the recipient area. The derma roller ensures that the hair follicles, the hair roots, are optimally strengthened so that when they are inserted into the recipient area, a significantly higher growth rate of 98% can be ensured, not just the average 80%. Accordingly, NEO FUE, clear recommendation for your hair transplant. What's particularly important now in this phase that I just described, so in the first 10-14 days, is to ensure that all elements are considered during the time when the grafts are secured. That's the hair wash in this case here. Of course, they'll explain the hair wash to you in detail when you get there. Ensures through the optimal use of care products, A, the nutrient supply, and accordingly, that the grafts can grow optimally. Equally important, especially in the first 2 weeks when that's still the most sensitive, is to stick to the rules, avoid sports and sweating. And that already covers the most important elements. So basically, just make sure you do what you're told on site. So I want to take a moment to talk about this one thing that you're going to come across, which statistically affects 95% of all patients. It's called shedding. Not to be mistaken with shock loss. Shedding refers to the phenomenon where, in the initial 2, 6, 8 weeks, the hair may shed once again after the transplantation, giving the impression that the grafts have also been lost. But just to make it clear, that's not the case. If that's the scalp, the grafts are placed under the scalp, and then in the end, there are new hairs here. They can fail again during the aforementioned period, as I said, but the grafts are not affected by this. That would be a total loss in this case, where the entire hair root is lost. So if you're wondering, when are my grafts secure? If you have hair loss of 2 to 6 to 8 weeks during this period, it's not your grafts that are affected, they are safe. It's actually the hair above them that falls out, but it will fully regrow in the first few weeks after. Let's summarize again. After 7-10 days, your grafts have grown and you can be confident that they will not fall out once more. Afterwards, during the 2nd, 6th, and 8th week, the so-called shading occurs. That means don't worry if some hairs fall out again here. That's just the hair and not the graft that's secured. In the follow-up phase, you can of course also proactively influence your result so that it looks as optimal as, for example, here with Marcel, or hopefully also with me, for example, through pills, biotin, and zinc. But I can also do the so-called booster measure, namely the platelet-rich plasma, PAP treatment, where enriched blood plasma ensures an optimal result. Otherwise, of course, after surgery, when you might also be asking yourself these kinds of things again, you have experts at your fingertips whom you can message on WhatsApp, and you always get feedback on the same day, so you don't have to worry about your grafts in the end. Thanks for watching. If you're interested in getting a hair transplant, you'll find the link below in the description box. Click to get a free hair analysis. For specific questions, write in comments. By the way, when are the grafts set? Feel free to ask any doubts you have about the topic.